Another cause that there is kind of interesting is some type of infections, more like bacterial. So it's kind of interesting how they're looking at possible, not like a meningitis or anything like a bacterial, but they're looking at some type of bacterial in the brain, like towards like the hypothalamus and stuff. Kind of interesting. The other thing is peripheral tissue dysfunction. So that means more of like skin disorders, more nerve, nerve tissue disorders. They're starting to look at that. Sleep disturbances. I mean, I think that's all. Does everyone here have difficulty sleeping at times?
Oh yeah.
I do.
Okay.
I can sleep like a baby.
I'm good, but getting there.
Yeah, the restlessness at night. Yeah, so a lot of people get that fog at night a little bit. Like we always joke and say the fog comes in. The fog comes in like at night, and you just feel kind of a little woozy, and then you're kind of restless, and then you finally get sleep.
Right.
Yeah, that's a common kind of a night issue that I've seen some of, at least in my sample of patients that I work with. Genetic factors is another huge one. We're definitely confirming more of that. And then we're looking at a lot of more central nervous system hormonal disorders. Okay? And I think, and as we go down to the next slide here, I think as we look at the next slide on your bottom left, is that a lot of times they're thinking it's more of a central hypersensitivity syndrome. That's what they're actually calling it now. And that tends to be the most plausible, where they're thinking it's something going on in a little thing in your brain called your hypothalamus. Okay, and it's
I have issues with bright lights and noise.
Yes.
So I think that's part of it.
Yes. Yeah, that's sensitivity. And so what they're saying is they don't know why yet, but what they're talking about is almost like the hypothalamus kind of it's kind of the control center of releasing our hormones in our body. Not, besides, so it kind of signals like the adrenal glands, and it signals all of our body. But what they're saying is somehow that kind of gets turned off. And so all the hormones, and especially like the serotonin, the gabapentin in our brains and stuff, all of a sudden kind of get whacked out, and we become hypersensitive to everything. So because of that, that stimulates our fight or flight, our sympathetic. You know how like someone scares us when we tighten up and we get stressed? So what they're saying is somehow deep in the brain, we're having like, some type of like off balance or a lowering of all these hormones that are causing our bodies to be hypersensitive. That's what's giving us a lot of the fatigue, a lot of the muscular achiness everywhere, right? Because as we know with fibromyalgia, sure, the diagnosis was all those tender points. Sure, that's great, but what about the trigger points? What about the tight knot that refers down? So there's a lot of soft tissue stuff that we have that if it doesn't get worked on or if it's not treated, it gets worse and worse. You guys feel that? And we deal a lot with it at our clinic. And we're one of the first to really we're starting to develop some new techniques for massaging fibromyalgia, because you can't go too deep. It's not like someone's going to walk on your back. and that would really sort of.
Yeah, me
I know
too.
it'd be awesome. I know, but you'd have to probably medicate up for weeks after that.
That feels great.
Oh, that's good. Yeah, because I know some people. Yeah, some people might be sensitive to that. Does that make sense? And so that's one thing that we've seen. So a lot of times though, we're seeing that our tolerance to pain, our threshold gets lower. So all of a sudden, our body starts to have the sensitivity. And guess what that means? That sensitivity to sight, sound. So all of our senses, I call the alarm system of the body, is constantly aware of everything. So that's when people are getting a lot of musculoskeletal pain. They might have jaw pain. They might get headaches. Okay, and so besides that, the only thing else that they're looking at is they're looking at if there's a link to thyroid problems. Okay, so it's because because sometimes the thyroid problems can actually replicate the same symptoms as some of the fibromyalgia. So they're kind of, so that's kind of the latest thing. But I think the most plausible theory is something's going on deep in our brain, and something's causing those hormones to kind of be off a little bit. Okay, and there's a lot of hormones that react right to our spine, and it creates this hypersensitivity of our whole body. Okay, and it's called the autonomic nervous system. I'm not going to get too nerdy about but just on a plain level, that's where when they give you guys the medications, they're all targeting the pain fibers. Do you guys see that? They're all targeting those pain fibers and stuff like that. But those medications come with a bunch more side effects, right? So it's kind of like, you buy a product, but now you have all the side effects and stuff. So that's kind of the current theory. Now let's kind of go into just some general signs and symptoms. And you guys are very familiar with this, but it's interesting where they have this in the literature where they call it the triad: myofascial pain, fatigue, and disturbed sleep. Those are the three key things I think that's important for you guys to look at when you guys exercise. Okay? Is because a lot of people try to push through it, but the question is, and I want to kind of pose it to you, and we'll talk more about the research and we'll talk more about clinic and stuff. Is it always good to exercise when you're fatigued or lack of sleep? Because can that actually trigger a worse event down the road?
Yep.
Okay, and that's exactly. And I think a lot of people who are first diagnosed with it, and we're talking about within the first year, we're starting to see that they're learning how to manage their new body. Does that make sense? We call that their new body.
You have to get a feel for when your cutoff is because, sometimes the only thing that hurts worse than exercising is not exercising. And, there's those times, and probably everybody has to depend somewhat on medications. And I describe myself as a zombie because until I have time to digest my morning routine, so some mornings it's like, you know what, I should just call it a day and forget about it. But you want to take that chance. So I'll med up, make it a couple hours, and decide I should have just stayed in bed. So then I go back to bed with all my medicines, and I'm laying there staring at the ceiling. Wish I wouldn't have taken all those medicines.
Yeah, exactly.
You do have to learn your own body.
You have to know your limitations.
No stimulants because I still work full time. I'm in a situation where I can't stop working, and so I do Provigil and Adderall and marching on.
No, and those are, but you know what though, those keep you functioning.
It takes a long time to get a feel for what's serious on your body and what you can do.
And also how to cycle your medications throughout the day, because our bodies are all different. We're all our architecture is all different inside, you guys. And so that's what I'm saying is I have some people who actually do better coming to physical therapy late evening. Some people do good right at 7 o'clock in the morning. It's very interesting when you're seeing this. And so, like I always say, is I always tell people that first year is you're really learning about your body. You really are. But it has to be a constant monitoring process. You have to constantly monitor your symptoms and try to work around it and stuff. Hi.
Hi, I didn't want to interrupt.
Oh, no. Can we pass it?
Do you want to sit there or you want to take it out in the hall?
I'd rather check it out.
Okay.
I'm trying to be in the
So, and so obviously, we know too, and we're going to go to the next page, along with those triad, the top 3 symptoms, we also got to look at a lot of the secondary stuff, and I think this is important too, is, obviously monitor feelings of depression and anxiety. The fibro fog, that's a huge one, okay, and I got people trying to work through that. And for some reason, the cognitive fog, when the fog settles in and stuff like that, it's better to try and, slow down your pace and stuff and not try to push through it because for some reason, I don't know the answer yet. I want to do a study on that, but I don't know how we can measure it, is that it seems like the people have a worse relapse after that fog and they're pushing through those. They're not feeling good, they're achy, everything's tight, and they push through it. They come, they're wiped out like 1 or 2 days after. I don't know if you guys have felt that. But for some reason, that fog, when it comes in, it stays.
Increases anxiety because you're trying to deny it and say, I'm going to get this done anyway.
I found how to measure it. Play that luminosity game.
Yes.
And I can find out, this day I did really, really good, and this day I just tanked. So at least I found out how bad I am.
Yeah, and it's good to be aware of that because if we're, like for me, like my mom, she's still in a leadership position of her job. She's